My name's Chris Rogan. I'm the president of the Interventional Radiology Society of Australasia, or IRSA, and we represent a niche specialty called Interventional Radiology, which performs image-guided, minimally invasive, essentially pinhole procedures for patients to treat a variety of illnesses. I'm grateful to have the opportunity to treat Michaela today, because if we can achieve turning off her pain for a few years, it's a really big difference to her quality of life. So I think it's really important that patients, surgeons and GPs hear about these things, and so then they can consider all options available and just have the opportunity to explore this with their healthcare professionals. Most people think that arthritis is just wear and tear, but that's an old understanding. We now know, and why anti-inflammatory tablets or injections work, is that there's an inflammatory pain that's really driving the pain that people feel in their knee arthritis. Genicular artery embolisation, it's a form of embolization therapy which people might relate to having heard about an angiogram before. So essentially, it's a procedure performed through a pinhole in the top of the leg. Embolisation, or GAE, is relatively new to Australia, although it's been practiced in Japan and in the US for over 10 years. We would hope and anticipate that if she's going to get a good response, within a few weeks' time she notices a significant reduction in her knee pain.
I've been experiencing knee pain from memory 7 to 8 years. It was getting to the stage that the medication was actually not working. Knowing I didn't have to go through another surgery because I'd found out about GAE was absolutely amazing. The downtime, there was no downtime really. GAE, I pretty much had the procedure and walked out. The most thing I'm looking forward to be honest, is walking away in 3 or 4 days pain-free.
I think GAE is worth considering for patients and their doctors because it fills a gap where patients are struggling between having injections or having a daily pain-killing tablet and the end of the line where they're having their joint replaced. There's not really many good options for these patients, so I think it's worth considering, because if we can achieve turning off their pain for a few years, it's a really big difference to their quality of life. Interventional radiology has a range of procedural options that are often underutilized due to a lack of information out there. So I'd really encourage specialists and GPs to consider collaborating with the interventional radiologist and asking, what options might be available.
My whole life changed that day when I walked into Dr. Gersel's office and he gave me the referral to Chris. It was a miracle. I have to say, he did the best job. If I could give him $1 million, I would. Speak to your GP, speak to the interventional radiologist, your knee surgeon, your orthopaedic surgeon.
If you're interested in learning more about genicular artery embolisation, whether it might be suitable for you, we have some information on the Interventional Radiology Society website, irsa.com.au. There's actually a brochure that you can download. If you need to be connected to an interventional radiologist, you can actually look up on the website via a doctor finder feature where you look to see an interventional radiology specialist in your area that you can reach out to.